So I need to be humble, no professor, just an ordinary doctor in theoretical physics, yeah. So, and too tall for that microphone, yeah. So I hope you can hear me, yeah. So sorry for this. So be serious, okay? So, Herr Luft, I chose the emotional topic, why I'm happy to be here, yeah. And I'm happy to be here because healthcare is a team sport. Why is it a team sport? Yeah, because healthcare is too challenging for one individual. Yeah, so that is why we choose to dedicate our life to a specialty. Yeah, so we are either in research, we are in medical practice, we are in policy making, we are in technology development, we are in global companies. And even in these respective fields, we subspecialize. Yeah, we become cardiologists, and then become whatever. Yeah, we become cardiac surgeons, or we become software developers, and so on and so on. And that is what requires team sports. Yeah, because we need to be deep, and on the other hand, we need to understand each other to solve the challenge as a whole. Yeah, and we should do this in a spirit where we don't believe that the specialty we chose is the one which is better. It's just a specialty. Yeah? And in a moment like this, I am happy to be here because I can meet all other people who have chosen different paths. Yeah? I personally had the big luck in my career, yeah, that I growing up in Siemens Healthineers, yeah, what is now Siemens Healthineers, that I can now lead an organization which is completely dedicated to making the healthcare system more efficient. Yeah? An organization of 50,000 passionate people, passionate about healthcare, who all have different backgrounds, yeah? From 20-year-olds to people close to retirement, from software engineering to superconducting specialists in MRI, to physicians, to regulatory specialists who work around the globe, yeah, whether it is the US or China, whether it's the Ukraine or Russia, yeah, or Israel or Saudi Arabia as one team, which I find exciting that this works, not with one exception. Every 4 years when we have the Soccer World Cup, it's a bit of a problem, yeah. But it shows, I think it is exciting that this is possible, yeah. But and I want to share from this perspective, yeah, why the World Health Summit matters for us. And I give you 3 reasons and a bonus reason. So number 1, what I think is exciting and interesting, and maybe something we are not always conscious of. Med tech and medical science is global. Healthcare is local. Yeah? So we all share the same technology and the same scientific knowledge, but the deployment is a very local, country-specific topic. Yeah? We have private healthcare systems like India. We have very public ones, state-driven like in China. We have the NHS. We have the German mixed systems. We have the big consolidators in the United States. Everybody does it in a different way. And I think this is something which is unique and which also shows that healthcare is a team sport, because we can learn a lot how to best do it. And for me, an opportunity like the World Health Summit is an opportunity to exactly have the exchange on this. The second topic, which I find is also a topic we should be all aware of, is how do we define impact? I have been at the meeting of the American Hospital Association 3 days ago, and there was a big discussion. It was interesting. There was a panel. It was moderated, what is the future of health? And there was a person talking about quantum computing and immunotherapy and so on, and then let's have a discussion. Yeah? And then people said, yeah, running the big hospital chains, well, this is all interesting, but my problem is that the life expectancy in one neighborhood of, let's say, Boston, is 12 years shorter than in another neighborhood. Yeah? So we have a problem, yeah, called the social determinants of health, or they also call it the social determinants of dignity, which shows a deep translation problem also. Yeah? How do we define impact? Yeah? Impact on the one hand in the sense of we have scientific impact, yeah, impact points, and so on and so on. We, as Siemens Healthineers, can take pride of some new technology and so on, but I think we should be humbled also by what really makes impact. And what really makes impact is how do we reach the people in emerging countries, how do we reach people in underprivileged areas of developed countries. Yeah? And this, again, is a team sport, and this, I believe, is, again, one of the great reasons to have this summit, yeah? Because here all stakeholders come together. The third big topic is digitalization. Not because it's the buzzword of the last years, but because it is gold in our hands, because digitalization is an innovation or a big theme which can solve many of the challenges we inherently have. It is not a high-cost innovation. Yeah, this is innovation with which we can reach affordability and accessibility very, very quickly. Yeah, there are more mobile phones, or the penetration of mobile phones is higher than the penetration with spectacles in India. Yeah? We can see how these technologies spread and how it helps to solve also many of the infrastructure problems of do we have enough trained specialists and so on and so on. And solving this together, using this huge potential is, I think, a big topic in itself, yeah? By solving also the special challenges healthcare has in terms of privacy, really security, and also respecting the existing medical specialties. And again, I believe this is a topic where healthcare is a team sport and requires all stakeholders as they come together here to work in one team. And now I come to the bonus topic. The bonus topic is, I believe we are all privileged that we can work in such an important topic which unites people worldwide. 7 billion people want to be healthy. We say in German, Gesundheit ist nicht alles, aber ohne Gesundheit ist alles nichts. Yeah? Health is not everything, but without health, everything is nothing. So this is a common theme. And if we demonstrate how we can work together as a global community with different views and different specialties, I think we can also be a beacon for other challenges in the globe. And not because we believe that we are better people, but because I believe we have the responsibility to give back for the privilege we have to be allowed to be active in this field. I hope that was not too much. That was the bonus topic. Yeah. Thank you very much. This is why I'm happy to be here.